Welcome back, everybody, to another deep dive. This time, we're going to be looking at AI in medicine, an essay by Jörg-Owe. And get this, back in 2023, a full 79% of healthcare organizations were already using some kind of AI.
Wow, 2023, that's incredible. Talk about a fast-moving field. The potential to change healthcare with AI is just enormous.
Absolutely. So Schneepat, he starts off, by taking us through the history of AI in medicine. Way back to the middle of the 20th century, those early rule-based systems, really basic stuff.
Yeah, and it's fascinating to see how those systems, like Schneepat talks about MYCIN from the 70s, how they kind of paved the way, for what we've got today. Imagine a system that could actually diagnose bacterial infections, and sometimes it could even do it better than human experts. It really showed everyone what AI could do in healthcare.
It really did. It's like straight out of science fiction, but it was happening way back then. So what really got AI in medicine moving faster, Schneepat, it seems like he's saying, electronic health records, EHRs, played a big role.
Yeah, Schneepat really makes a point about that data, having that data readily available. With EHRs, suddenly you have this mountain of patient info, and AI can actually analyze it, like giving a detective all the clues to crack a case.
And those clues, they can uncover some really incredible insights, right? I mean, Schneepat talks about how AI can look at data and actually find those patients who might be at risk for chronic diseases, or even figure out who might end up back in the hospital.
Yeah, exactly. That's the whole point of predictive analytics, right? Instead of waiting for the problem, we can use AI to actually step in, proactively, maybe even prevent those problems from happening in the first place.
Wow. It's like having a personalized early warning system for your health. Speaking of personalized, Schneepat also talks about how AI is totally changing precision medicine. We're moving away from that one-size-fits-all approach.
He's right. It's not one-size-fits-all anymore. AI can help create treatments that are tailored to a person's genes and their lifestyle. It's all about moving towards healthcare that's truly, individualized and effective.
That's amazing. And then you can't forget about AI in drug discovery, right? Schneepat mentions these companies, Berg and Benevolent AI. They're using AI to develop new drugs, especially for rare diseases. Those have been so hard to treat.
Yeah, AI has just incredible potential there. Think about all these diseases that have been around for centuries, AI could be the key to unlocking new treatments, maybe even cures. It's pretty exciting to think about.
It really is exciting to think about all the possibilities. But with any new technology, there are always those potential downsides, right? Schneepat, he spends a lot of time in his essay talking about those challenges, the ethical considerations with AI in medicine.
And he's right to do that, absolutely. One of the biggest concerns he brings up is how AI could actually make existing health disparities worse if we're not really careful. We have to think about how we train these AI systems, right? Because if that data is biased, well, it could mean that some groups don't get treated fairly.
That's a really important point. So we need to make sure that the AI is seeing the world in a way that's inclusive, not just reflecting the biases we've had in the past. We don't want to keep those inequalities going, especially in healthcare.
No, absolutely not. And then there's the whole issue of training, professional training. Schneepat says healthcare professionals need to know how to use these AI tools well, how to use them effectively. It's a whole new skill set, something we have to work into medical education.
It's like AI is forcing everyone in medicine to kind of level up and get used to this landscape that's changing so fast,
Exactly. And Schneepat, he stresses that we need to keep talking about these things. We need those ethical frameworks to guide how AI is developed, how it's used in medicine. It's not just a one-time conversation. It's something that has to keep evolving right alongside the technology.
So we've talked about some of the big challenges. But what about, how AI is actually being used in healthcare right now? Schneepat mentions so many things, from virtual assistants to, AI doing triage.
There are so many cool examples. One Schneepat talks about is AI chatbots being used by the UK's National Health Service. These chatbots, they can actually help people, figure out their symptoms, get advice.
That's amazing.
Yeah.
That's like having a virtual doctor, right?
Yeah.
Available all the time. That could really help people who have trouble getting to a doctor, people in rural areas, for example.
Exactly. And think about what it could do for healthcare systems, taking some of the pressure off. If a chatbot can handle the basic stuff, the simple questions, then human doctors, they can focus on those really tough cases.
It's like AI is like the first line of help, and then the human experts can come in where they're really needed. That's brilliant. Schneepat also talks about how AI can help take care of patients better, monitoring vital signs, managing meds.
It's about making healthcare more responsive, more proactive. Instead of waiting for things to go wrong, we can use AI to, keep an eye on patients in real time and jump in early if something's up. That could lead to, better outcomes, maybe even save lives.
It really feels like we're on the edge of a healthcare revolution, doesn't it? With any powerful technology, you have to think about those ethical questions. Schnepphat doesn't shy away from that in his essay.
He doesn't, no, and it's important. One thing he really emphasizes is, if we're not careful, AI could actually make those existing health disparities we see even worse. We've already seen how bias can sneak into algorithms in other areas, and healthcare is no different.
It's something to really think about. We need to be sure these AI systems are trained on data that's diverse, that represents all kinds of patients. If we don't, we could just end up making those inequalities in the system even worse.
Schnepphat makes a strong argument for transparency, too, in AI systems. We need to know how these systems are making their decisions, especially in healthcare, where it's so important.
It's not enough to just say, well, the computer said so, right? We need to know why the computer came up with that answer. That's how we build trust in AI, especially when it's part of healthcare.
Exactly. And what about the people on the front lines, the healthcare professionals? Schnepphat asks some really interesting questions about how AI might change what doctors, nurses, and other providers do, how their jobs might change.
Yeah, I bet a lot of people in healthcare are worried that AI might replace them, take their jobs. But Schnepphat, he seems to think that AI will actually help human experts, not replace them.
Right. That's right. He talks about how we need new training programs and how people in healthcare need to think about working with AI, collaborating. Doctors and nurses, they're going to need to learn how to work with these systems, be a team.
So it's not AI versus doctors. It's more like AI and doctors working together.
Exactly. And Schnepphat brings up patient education, too.
Yeah.
People need to understand how AI is being used so they can make informed choices about their own care.
So it's about giving patients the power to decide, not just doing whatever the AI says. I like that. It puts the focus back on the person.
It's important. And then Schnepphat gets into the future trends he sees. He thinks machine learning, that's going to be a huge part of diagnosing diseases, even more than it is now.
It makes sense, right? AI can look at those huge data sets and see patterns that humans might miss. That can mean earlier diagnoses, more accurate ones. But are there downsides to relying so much on AI for diagnosis?
Schnepphat knows those concerns exist, especially that black box idea. We don't always understand how AI algorithms get their answers. And that can be a little scary, especially in medicine where the stakes are so high.
It's like the AI is some brilliant oracle, but we don't understand it. We're just supposed to take its word. Kind of unsettling.
Yeah, I can see why people would feel that way. Schnepphat argues that we need AI systems that are more transparent, more explainable, especially in healthcare. You can't just blindly trust the algorithm when it's people's lives we're talking about.
Transparency, explainability, they're so important. But it's bigger than just the technology itself, isn't it? It's about the ethics, the social impact of AI in medicine.
You got it. Schnepphat keeps saying we need to keep discussing these issues. It's not a one-time thing. It's a conversation that has to keep going as the technology changes and improves.
And it's a conversation we all need to be part of. AI can change healthcare for the better, but we have to be sure it's used responsibly, ethically.
Schnepphat's essay gives us a good way to think about this whole issue, this really complicated, fast-changing world of AI in medicine.
It definitely gives us a lot to think about. And there's still more to explore in what Schnepphat sees for the future. So we've talked about a lot with this essay by Jörg-Owe Schnepphat, AI in medicine. We've gone through the history, all those amazing possibilities, and of course the challenges, right? But what about the future? Schnepphat has some really interesting thoughts on where AI in medicine is heading.
Yeah, he does. It makes you think. One of the things he focuses on is how AI could change, like the whole idea of healthcare roles.
So not just AI as a tool for doctors, but AI changing how the whole healthcare team works.
Exactly. Schnepphat sees a future where those AI systems are woven right into how things are done in hospitals and clinics.
Yeah.
They'll be collaborating with human experts much more closely, more like partners.
It's almost like AI becoming, an actual member of the healthcare team, right?
Well,
I wonder how that will change things between doctors and nurses, the whole dynamic of the team.
yeah, Schnepphat even thinks we might have totally new jobs in healthcare. Think about it, specialists who focus on understanding what the AI is saying, or people who manage those AI systems.
Wow, that's pretty cool. It's like a whole new kind of medicine is being born. And that would mean big changes for education and training in healthcare, wouldn't it?
Right, Schneppet makes that point too, for sure. He also asks some interesting questions about how AI might change the relationship between a doctor and a patient.
Hmm, that's an angle I hadn't really thought about before. How could AI affect that connection? That's an important one.
Well, Schneppet says there's good and bad there, potential benefits and risks. On the one hand, AI could free up doctors' time so they could spend more time with their patients, really build that relationship.
Yeah, a lot of people feel like they don't get enough time with their doctor these days, so that could be a good thing.
Right. But then there's the worry that AI could make healthcare feel less personal, less human. If patients are mostly talking to chatbots or AI systems, will they feel like their needs are really being understood?
It seems like it's all about finding that balance, right? Using AI because it can be so efficient, but also keeping that human touch, that human connection in healthcare.
Yeah, it's a tough balance. And Schneppet, he doesn't act like he has all the answers. He just puts these questions out there for us to think about, which I think is great.
It's about starting the conversation, making us really think about these issues, these complicated issues. And that's what Schneppet's essay does so well. It brings us back to how important ethical considerations are in everything we do with AI in medicine.
That's a thread that runs through his whole essay. We can't forget about things like bias in algorithms, data privacy, transparency. Those aren't just technical problems, they're ethical ones.
It all comes down to making sure that AI is used to help everyone, all patients, not just a select few. AI can't be allowed to make those existing health disparities even worse.
Exactly. And Schneppet leaves us with a really interesting question. What if, he says, AI could look at all our data and tell us what our individual health risks are, predict them.
That's a powerful idea, isn't it?
Yeah.
But it raises so many ethical and social questions. Would we even want to know that kind of information? Who should be allowed to see it?
Those are the things Schneppet wants us to wrestle with. He's not giving us easy answers. He's asking us to be part of this conversation, to help shape how AI is used in medicine in the future.
And that's really what this whole deep dive has been about. Looking at what AI can do, seeing the challenges, and talking about the future we want to build.
Yeah, well said. It's been great exploring Schneppet's ideas with you.
Thanks for joining us on this deep dive into the world of AI in medicine. Keep learning about it, stay informed, and be part of shaping the future of healthcare. Until next time, everyone.